Vitamin D is an essential nutrient that plays many important roles in the body, including promoting bone health, supporting the immune system, and regulating mood. However, many people are deficient in vitamin D, which can lead to a range of health problems. Here are 14 signs of vitamin D deficiency to watch out for. Bone health. Vitamin D helps the body absorb calcium, which is essential for building and maintaining strong bones. A deficiency can lead to weak and brittle bones, which can increase the risk of fractures. According to a study published in the Journal of Bone and Mineral Research, adults who were deficient in vitamin D had a 33% higher risk of hip fractures compared to those with normal levels. Immune function. Vitamin D plays a crucial role in supporting the immune system, and a deficiency can increase the risk of infections and other illnesses. According to a study published in the British Medical Journal, individuals with low vitamin D levels had a higher risk of respiratory infections such as colds and flu. Depression. Vitamin D is important for regulating mood, and a deficiency has been linked to an increased risk of depression. According to a study published in the Journal of Internal Medicine, individuals with low vitamin D levels had a higher risk of depression. Prevalence. Vitamin D deficiency is a widespread problem, especially in certain populations such as the elderly, people with darker skin, and those who live in areas with limited sunlight. According to a report from the National Health and Nutrition Examination Survey, NHANES, 28% of adults in the United States have inadequate levels of vitamin D. Treatment. The most effective way to treat vitamin D deficiency is through supplementation. According to the Endocrine Society, adults with vitamin D levels below 20 nanograms per milliliter should take 2,000 to 4,000 IU of vitamin D3 daily to reach and maintain a level of at least 30 nanograms per milliliter. Sun exposure. Sunlight is an important source of vitamin D, but it's difficult to get enough vitamin D from sunlight alone. The amount of sun exposure needed to produce enough vitamin D varies depending on factors such as skin color, location, and time of day. However, it's generally recommended to get 5 to 30 minutes of sunlight exposure on the face, arms, or legs, 2 to 3 times a week. Food sources. Vitamin D is found in a limited number of foods, including fatty fish, egg yolks, and fortified foods such as milk and cereal. However, it's difficult to get enough vitamin D from diet alone, which is why supplementation is often recommended. In a study published in the Journal of the American Medical Association, researchers found that low levels of vitamin D were associated with increased risk of fatigue and difficulty thinking clearly. Another study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin D deficiency was associated with an increased risk of bone pain, muscle weakness, and fractures. A review of studies published in the Journal of Steroid Biochemistry and Molecular Biology found that low levels of vitamin D were associated with an increased risk of depression, chronic pain, and decreased immune function. In a study published in the Journal of Hypertension, researchers found that low levels of vitamin D were associated with an increased risk of high blood pressure. A study published in the American Journal of Clinical Nutrition found that low levels of vitamin D were associated with an increased risk of all-cause mortality, including deaths from cardiovascular disease, cancer, and respiratory disease. In a large meta-analysis published in the British Medical Journal, researchers found that vitamin D supplementation was associated with a 12% reduction in the risk of all-cause mortality. A study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin D supplementation improved bone density and reduced the risk of fractures in postmenopausal women with osteoporosis. Another study published in the Journal of the American Medical Association found that vitamin D supplementation reduced the risk of falls in older adults by 19%. In a study published in the Journal of Investigative Dermatology, researchers found that vitamin D supplementation improved symptoms of atopic dermatitis, eczema, in children. These studies provide statistical evidence that vitamin D deficiency can increase the risk of various health outcomes, and that vitamin D supplementation can improve these outcomes. However, it's important to note that more research is needed to fully understand the role of vitamin D in these health outcomes and to determine optimal levels of supplementation. Vitamin D deficiency can affect anyone, there are certain populations who may be at higher risk and should pay particular attention to their vitamin D status. These populations include older adults. As we age, our skin becomes less efficient at producing vitamin D in response to sunlight, and our kidneys become less effective at converting vitamin D to its active form. This can put older adults at higher risk for vitamin D deficiency. People with dark skin. Melanin, the pigment that gives skin its color, reduces the skin's ability to produce vitamin D in response to sunlight. As a result, people with darker skin are at higher risk for vitamin D deficiency. People with limited sun exposure. If you spend most of your time indoors or cover up when you are outside, you may be at higher risk for vitamin D deficiency. People with certain medical conditions. Certain medical conditions, such as inflammatory bowel disease, celiac disease, and liver disease, can interfere with the body's ability to absorb and use vitamin D. People taking certain medications. Some medications, such as anticonvulsants and glucocorticoids, can interfere with vitamin D metabolism and increase the risk of deficiency. Pregnant and breastfeeding women. Pregnant and breastfeeding women have higher requirements for vitamin D, as it plays a crucial role in fetal and infant bone development. Vitamin D deficiency during pregnancy has been linked to an increased risk of preeclampsia, gestational diabetes, and preterm birth. Children and adolescents. Adequate vitamin D intake is important for children and adolescents, as it helps support healthy bone development. Vitamin D deficiency during childhood and adolescence can increase the risk of rickets, a condition that causes weak bones and skeletal deformities. People living in northern latitudes. People who live at northern latitudes, where the sun is weaker, may have a higher risk of vitamin D deficiency. Overweight or obese individuals. Vitamin D is stored in fat cells, so people who are overweight or obese may have lower levels of vitamin D in their blood. If you are concerned about vitamin D deficiency, there are several steps you can take. Get tested. Ask your healthcare provider to test your vitamin D levels. This will help you determine if you have a deficiency and how much supplementation you may need. Get some sun. Vitamin D is produced in the skin in response to sunlight. Spending time outdoors in the sun can help boost your vitamin D levels. However, it's important to be cautious and avoid excessive sun exposure, which can increase the risk of skin cancer. Eat vitamin D-rich foods. Some foods are naturally rich in vitamin D, including fatty fish, such as salmon and tuna, egg yolks, and fortified foods, such as milk, cereal, and orange juice. Consider supplementation. If you have a vitamin D deficiency, your healthcare provider may recommend supplementation. Vitamin D supplements are available in several forms, including capsules, tablets, and drops. Consult with your healthcare provider. It's important to work with your healthcare provider to determine the best course of action for maintaining optimal vitamin D levels. Your provider can help you determine the appropriate dose of supplementation based on your individual needs and health status. Be aware of your risk factors. Some people are at higher risk for vitamin D deficiency, including older adults, people with dark skin, people with limited sun exposure, and those with certain medical conditions. If you fall into one of these categories, talk to your healthcare provider about ways to reduce your risk of vitamin D deficiency. Follow safe supplementation practices. If you decide to take vitamin D supplements, be sure to follow safe practices. Don't exceed the recommended dose, and choose high-quality supplements from reputable sources. Monitor your symptoms. If you have symptoms of vitamin D deficiency, such as fatigue, bone pain, or muscle weakness, be sure to talk to your healthcare provider. These symptoms may indicate a need for further testing or treatment. Stay informed. As with any aspect of health, it's important to stay informed about new research and guidelines related to vitamin D. Follow trusted sources of information and talk to your healthcare provider if you have questions or concerns. In conclusion, vitamin D is an essential nutrient that plays a crucial role in maintaining optimal health. A deficiency in vitamin D can have serious consequences, including increased risk of bone fractures, osteoporosis, and certain chronic diseases. The signs of vitamin D deficiency can be subtle and may include fatigue, bone pain, and muscle weakness. There are several steps that individuals can take to ensure they are getting enough vitamin D, including spending time outdoors in the sun, eating vitamin D-rich foods, and considering supplementation. However, some populations may be at higher risk for vitamin D deficiency and should pay particular attention to their vitamin D status, including older adults, people with dark skin, people with limited sun exposure, and those with certain medical conditions. By being aware of the signs of vitamin D deficiency, taking steps to maintain optimal vitamin D levels, and working with healthcare providers to monitor and address any deficiencies, individuals can support their overall health and well-being. It's important to note that while vitamin D is essential for health, it's also possible to get too much of it. Excessive vitamin D intake can lead to toxicity, which can cause a range of symptoms including nausea, vomiting, and kidney damage. It's important to follow safe supplementation practices and not exceed the recommended dose of vitamin D. Vitamin D is a vital nutrient that plays a key role in maintaining optimal health. By being aware of the signs of deficiency, taking steps to maintain adequate levels, and working with healthcare providers to address any deficiencies, individuals can support their overall health and reduce their risk of related health complications.